three.
Number 3. More white women get breast cancer. Why black women die at a faster rate as a result? Of course, Breast Cancer Awareness Month is October, and we're focused on that right now. Joining us is Dr. Regina Hampton, Medical Director and Co-founder of Breast Care for Washington. I got to ask you, I mean, explain that. How in the world is it that black women have a lesser chance to get it, but are dying at a much faster rate?
So there are several factors that play into those numbers. One is that African American women develop breast cancer at younger ages. So we also develop a more aggressive form of breast cancer called triple negative breast cancer. And those cancers mean that the tumor cells don't respond to some of the standard treatments like hormonal therapies, which traditionally women can stay on for 5 years. African American women with triple negative disease are not, don't have access to that type of medication because it just doesn't work for them.
Also, how do you have, there's a particular ward here in D.C. that's the highest rate in the country?
Yeah, so Ward 8 has some of the highest breast cancer mortality rates of breast cancer in the country.
Why?
Again, because women develop breast cancer at younger ages. There really was no access to mammography in that ward. And so that's one of the things that I've been focused on trying to do, is trying to make a change in that ward by offering the latest and most greatest technology that we have available.
Have scientists also determined why black women are getting breast cancer at a much younger age?
We think it's genetic. They have seen that in African immigrant women as well. So we think there is a genetic link, and those studies are still forthcoming.
And as part of that issue also, you don't have enough black women who are in those national studies.
That is correct, yes. It's interesting that we live here in the district where the NIH is just up the street, but yet we don't have enough African American women that are enrolled in studies.
What are the 3 most important things you want black women to do when it comes to the issue of breast cancer?
So I want black women to be advocates for their own health. I know that we're caregivers, we're head of households, but we've got to be our advocate for our own health. We've got to get our mammograms. We've got to know when something is wrong in our breasts and not be afraid to get it checked out.
And when you say, we also have heard about, well, some people say, well, don't do mammograms, do mammograms, and you, again, conflicting information. Is it still your advice, look, forget the other drama, you must still get this done?
Absolutely. You know, so part of the drama is they're saying that women should wait until age 50. African American women can't afford to wait until age 50. We develop breast cancer under the age of 50. So we need to start mammograms at age 40, and we need to know our family history, because if women in our family developed breast cancer at younger ages, we need to start even earlier than 40.
All right then, Regina, we surely appreciate it. Thanks so much.
Thank you.
All right, and we have more segments on the issue of breast cancer in this month of October. Coming up next, we'll hear from the cast of Birth of a Nation, the impact prayer had on finishing this film.